Hello everybody, I'm Amanda. I'm going to show you how to set an IRRAflow up properly. So you first need three things whenever you're ready to set up your IRRAflow. First one is going to be your drainage bag, it looks like this, and you need your tube set that looks like this, and you will also need your IRRAflow catheter. Those are the three pieces that you need. You can either find them in the clean utility, or if we don't have them, then you can go to materials and ask for them. They will show you, and then you can just grab these three things. The catheter is going to go to whoever is actually putting in the IRRAflow, so you can set that aside. To set up your IRRAflow, you will grab your tubing from the package, and again, this will be a sterile technique to do this, and it's already going to be connected. So this part here will be connected, and this is going to go to the actual patient, which will be on the left side of it. And then the right side is going to be where you're going to get your fluid and drain your fluid. So the top one, you will see will already have your spike ready to go. You'll put that in your typical normal saline. And then the bottom piece is going to go to your drainage bag. So again, this will be a sterile process, but when you're doing it, you will take this portion that's going to go in your drainage bag, and you'll just hook it right to it. You can set that over here on your little lever and push that down so it stays. And then the other two pieces will, if not connected, be connected like this, and you can keep them that way until you're going to hook it up to your patient. Once you're ready, pull this out for a second. There we go. All right, you're going to turn it on. Okay, and you can hit setup tutorial if you're not sure exactly how to do it. That'll show when you're connecting the drainage bag, irrigation, and then the actual tubing connected to the patient. You're going to, I'm going to zoom in here so you can see, put these two dots onto these pieces and then push up from there. If it doesn't feel right, then just keep on going until it sets like that. It'll push down and you'll hear that click. From there you can put your piece up to protect it, and you will hit continue. There you need to calibrate it, so you'll go to 0. Once it gives you this little green check mark, you'll go back to ICP and it'll be a success. Then you can prime, so you'll hit your prime, and if it gives you a system error, that means you just have to unclamp all of your lines here. So I'm going to unclamp real quick. We'll try again and see if it works. Confirm. From there, you'll see the fluid going here. If it doesn't go, try to give the bag a little squeeze and make sure you don't have any kinked off areas. It's going to go into your drainage bag, so just make sure when you're done priming that you tip it back so that you don't think that that's fluid from your patient. Once you're done priming, it's going to give you the bubble sensor indicator. So you're going to take from your fluids here and you're going to just floss it right in to the sensor over here. Make sure that it's as deep as it can go, or else it'll give you a malfunction. You're going to go ahead and put your fluid volume in. I typically will put whatever I have, 200 less, just so I have a little bit of time. Hit continue. We are in water. Yep. I had to think about it, sorry. And then you're going to pick whatever procedure you're going to use. So fluid exchange, drain only, or monitor only. As soon as you put it in, before you get your CT, to make sure you're going to hit your monitor only, so that there's nothing actually happening. You're not actually irrigating or draining. From there, you're just going to go with whatever your doctor's orders are on the Cardex. And then as soon as you actually connect and you're ready to, you'll go on over to the patient. You will open up sterile, and wait for the doctor to be ready. And then your top one, and you can just keep an eye on whichever one that is. This one is my top sensor, so that is the one that the fluid is going to go into the brain. The bottom is the one that is coming out. So you'll tell that surgeon or whoever's putting it in that that's the fluid irrigation one, and then the bottom one is the drainage one. That'll be connected to the patient. You'll go to CT. As soon as they say that's okay, you can go ahead and hit start. and just it'll start working. Two things that we have as a resource if you need it on NCCU in the conference room is our super user training guide and our IRRAflow kind of resource book that we have our guide there. Also, you can use the app. It is the IRRAS or IRRAS app that you can use, and you can download it on your phone. It's completely free, and it gives you way better tutorials than probably this one. All right, that's all I got. Thanks, guys.